During the summer of 2018, I was training for two major events in my life. Number one, along with the rest of the class, the EIS class of 2018, I was training to be a disease detective, and we started our summer course right here in Atlanta. Number two, for reasons still unclear to both of us today, I signed my wife and I up for an Ironman triathlon. An Ironman triathlon is a 2.4-mile swim, followed by a 112-mile bike ride, finished off with a 26.2-mile run, or a marathon. And people often conjure up these heroic images of Ironman triathletes as these larger-than-life figures. However, my wife and I, we're just your average couple with a pair of really cheap aluminum road bikes. So my summer course memories are filled with epi lectures interspersed with swim workouts, bike run bricks, and Saturday morning bike rides along the Silver Comet Trail, as you see here on the right. Before we knew it, we packed up our bags and we shipped off to Montgomery, Alabama, so I could begin my assignment with the Alabama Department of Public Health. And as it turns out, Montgomery is a fascinating place and a beautiful place to train for a triathlon. This park is less than a mile from our home. And so as our race day nerves were starting to accumulate and race day was approaching, that week leading up to our big event, everything changed. The health department started receiving electronic laboratory notices for Streptococcus pneumoniae, or pneumococcus, detected in the cerebral spinal fluid and in the blood of two separate inmates from a state prison in Alabama. In addition to these two laboratory notices, the health department also heard from their workers' comp organization representing employees at this particular facility. After some initial outreach to the clinic, where we started to receive more information about this supposed outbreak, all that communication ceased once that employee spoke to their supervisor. So by the time that the third laboratory notice, this one also cerebral spinal fluid, by the time that notice arrived, we knew that the health department had to get involved, and soon. However, the Department of Corrections at that time was refusing to allow us to start an on-site investigation. And so we had to find a diplomatic way to break into this prison. An EPI-8 investigation is called when a public health authority requests CDC assistance and resources to address an urgent public health threat. In this situation, it was extremely helpful to have a subject matter expert at CDC weigh in on the seriousness of this outbreak and really helped us get moving things along. And so, the Friday before our Ironman, I was called in to lead this EPI-8 investigation. And I was thrilled. However, I had to leave my wife, Jackie, to finish her first triathlon, an Ironman triathlon that I signed her up for. I had a feeling when I got back from my EPI-8, I was going to be spending a few nights on the couch. However, on that Friday afternoon, it was an easy decision for both of us. I was happy to serve. And in many ways, I felt like I was thrown into my own Ironman in Alabama, and I had been training for this for a very long time. I was also in the greatest shape of my life, and you never know when that might be useful when investigating an outbreak at a prison. So the next morning, while Jackie was driving north to Tennessee, I was driving south to join our field investigation team at the local county health department closest to the prison. As with any triathlon, an Ironman triathlon begins with the swim. And just like the beginning of the swim during an Ironman, the beginning of our outbreak felt purposeful but chaotic. When the pistol shoots off and all the athletes sprint into the water and you're thrashing for position and you're trying to sight the distant buoy on the horizon, that's when you can finally start making progress. And so at the beginning of this outbreak at the prison, things were equally as chaotic. We arrived on Saturday morning. However, we couldn't access the facility until Monday because we were told that there wasn't enough staff to help us pull medical charts and to start these interviews with the inmates. And so on Monday morning, we arrived to the prison, and despite setting a date, a time, and a location, the prison seemed genuinely surprised to see us. And I was surprised that they were surprised to see us. And so after waiting in the administrative building for 2 hours, we were escorted to a visitation room that was very similar to this room. And after waiting there for another hour, we finally had an appropriate entrance meeting where we discussed our investigation plan, which, as I mentioned, involved medical chart abstractions and interviews. Another thing that surprised me was that we couldn't bring in computers or cell phones into this facility. And even if we could, there was no internet network that we could connect to, and the cell phone signal was extremely weak in this part of rural Alabama. So eventually, we laid our investigation plan, and we started to get into the routine work of our outbreak investigation. And really, this brings me to the bike portion of my Ironman EpiAid, because the bike portion of an Ironman takes the longest. You spend an entire workday as you pound through these 112 miles on the bike, and it's extremely uncomfortable. It's also boring and sometimes exciting, but eventually you start to make progress towards the next portion. You're reminded that as an Ironman triathlete, as well as being an EIS officer, you become comfortable with being uncomfortable. Although I've treated many inmates as an emergency medicine PA, I never thought I'd actually visit a correctional facility. It struck me as a rigidly hierarchical workplace, and orders were to be obeyed and leaders were not to be questioned. And that brings me to the warden. He or she is responsible for the well-being of the inmates, the safety of the staff, and the policies that dictate how a prison operates. On the first day of our visit, I was walking to join my team in the visitation room when a correctional officer stopped me and told me that the warden wanted to meet with me one-on-one in his office. And so it was with some trepidation that I entered his dark office, and it was lit by a single window. And without any explanation, he asked for my social security number. I asked him why. He says, for a background check. And then he says, if it comes back dirty, I'm going to have to lock you up. And then he let out this kind of grunt sound. I think it was a laugh. And then after frantically thinking to myself whether if I had any unpaid parking tickets, I realized that in that moment what I was experiencing was fear. But it wasn't the fear that you normally experience during an outbreak, such as the fear of another meningitis case happening in an inmate or another death occurring while you're trying to prevent it. It was a fear for my own personal safety and well-being at that moment. And so my supervisor later told me that she thought that this was an intimidation tactic. And after a few moments of silence, the warden opened up the door for me to exit, and I joined my team back in the visitation room. I told my CDC investigation co-lead about this incident, and we agreed to implement a buddy system not only when we were interacting with the inmates, but also with the Department of Corrections staff at the prison. The interviews that we conducted were extremely helpful in helping us understand the nuances of prison culture and the complexities of running a correctional facility. And it was reinvigorating to speak directly to the population that we were hoping to protect. And I found the inmates to be very kind, courteous, and curious about our investigation. In fact, to me, they were indistinguishable from the patients that I would see in my old emergency room, the ones that were not incarcerated. We learned that some inmates were convicted of murder, sexual assault, and at least one was serving a life sentence. This gave us pause because the correctional officers during our interviews could be as far as 20 or 30 feet away. And so we had to balance our need for absolute safety with the need of the prisoners' need for privacy, as they were sharing intimate details about their injection drug use and sexual behaviors within the prison. But the interviews with inmates also taught us about the barter economy within a prison. Inmates could trade drugs, cigarettes, and anything else that they can get their hands on. But one other thing that surprised me was that a bed assignment could be traded as well. So although an inmate might be assigned to a certain bed, that doesn't necessarily mean that they'll be sleeping in that same bed. And the perception of safety among some bed assignments was different from the safety of other bed assignments, say in a different dorm. And the paper medical charts that we had to use to examine clinical information from the prison clinic were of very poor quality, and that made our data analysis extra challenging. We heard inmates say that sometimes they had access problems when they needed health care. We heard from the clinic staff that sometimes it was difficult to differentiate authentic medical complaints from those that are being exaggerated or perhaps or made up for secondary gain. The final part of an Ironman is considered by most to be the hardest. That is, after spending an entire workday doing aerobic exercise, you then had to run a full marathon to get to the finish. Our time at the prison was limited. We were given 3 or 4 hours to abstract our medical charts and to interview the patients, after which we would then go to the county health department to clean our data, to upload it, and to prepare it for analysis. We learned at this time that the prisoners were becoming restless because of the control measures we had put into place. Also, the warden was eager for the prison to return to normal operations at the prison. And it was during this final week that I saw the cumulative effect of sleep debt, of daily frustrations at the prison, and also perhaps being away from home for several weeks at a time. Our team had to work under the pressures of limited time access at the facility. We had to work under hostile and uncooperative leadership, and also it started to wear on our team. But despite this, it was in those final days of our outbreak that I knew I had made the right choice to become a disease detective. I knew I had found my life's calling in public health because I looked around me and I found myself surrounded by inspiring people that didn't flinch at hard work when there was disease and death that could be prevented. These were people that were putting the needs of the inmates of some of our most vulnerable populations in our country before the needs of their own. In one of our final meetings, the warden dismissively threw the agenda papers out in the middle of the conference table, and he gave us a time by which he would like for us to leave, regardless if our investigation was complete. Fortunately, there hadn't been any more confirmed cases since we arrived at the prison and since we administered prophylaxis. Although the local warden in this investigation made things a little bit more difficult than they needed to be, the relationship between the central offices of the Department of Corrections and the health department did improve as a result of this investigation. In an unrelated outbreak several weeks later, the response was swift, the collaboration was effective, and control measures were put into place quickly. And that was all done without CDC involvement. This experience has taught me that the complexity of field epidemiology is something you can never learn in a classroom. That EPI investigations can sometimes help public health authorities overcome these barriers in communication and in politics, and that the effectiveness of the work that we do is proportional to our ability to forge relationships between organizations and their sometimes reluctant leaders. With the generous guidance of my epidemiology mentors and coaches, I'm happy to report that I made it to the finish line of my Ironman EPI. And so did my wife. Thank you.